Hi, my name is Nikki Roberts, and I'm going to provide you all with a topical brief on how predictive analytics are shaping the way government agencies and businesses are preventing healthcare fraud. Before we jump into fraud, I think it's important to look at data analytics in the healthcare industry holistically. Below are the 5 biggest trends in data in the healthcare space. First is the ability to provide value-based, patient-centric care. Second is how the Internet of Things is shaping healthcare practices. Third is how healthcare providers are using predictive analytics to improve patient outcomes through things like streamlining research for new medicines. Fifth and finally, big data is being used in the reduction of fraud, waste, and abuse, which will be the focus of our discussion today and represents a huge opportunity for this industry. So before we can jump into how we are going to analyze data to prevent fraud, we must first review the data that we'll be drawing our conclusions from. Healthcare data stems from a number of different sources, and they are all pertinent to the healthcare fraud discussion. One critical factor of this data is that it is both real-time and historic. As you can see in the illustration, the integration of data pools is required for major opportunities in terms of analysis. Because fraud detection necessitates a variety of data sources, governments and businesses alike are moving towards data lake architectures and frameworks in comparison to traditional data warehouses. These data lakes are made up from data from sources such as claims, clinical information, pharmacy data, electronic medical records, logs and notes, third-party data, and additional sources. The key takeaway here is the healthcare industry is moving towards the adoption of data lakes as a way to analyze data faster than ever before, which offers decision-making opportunities in as close to real time as possible. So now let's look more closely at why organizations are leveraging data science to combat healthcare fraud. The National Healthcare Anti-Fraud Association conservatively estimates that 3% of all healthcare spending, or nearly $60 billion annually, is fraudulent. This fraud does not only hurt the bottom line for insurance providers and large government organizations. Medical identity threat is on the rise and has already victimized 1.5 million people. This has cost individuals an average of $20,000 each. These fraudulent payouts result in higher healthcare costs in the form of higher premiums from all and detracts from our overall healthcare spending, which could be put to much better use. Now that we understand both the data that we have to work with and the reason why healthcare organizations are working to combat fraud, we should take a deeper dive into the type of analytics that are enabling fraud detection. Fraud detection can take the form of both supervised and unsupervised modeling. Predictive modeling is a supervised approach which combs through data and spots attributes that distinguish a fraudulent claim. Fraud detection systems also rely on unsupervised techniques, as these systems are also working to spot anomalies that may not be within the bounds of the supervised structures, but do represent a concerning claim. Because fraud detection data mining techniques rely on both structured and unstructured modeling, it is necessary to think of them in a layered approach. Simply put, the healthcare industry must use a fraud control model that integrates fraud prevention and detection at the front end of the payer workflow, applies analytic controls throughout the workflow, and incorporates post-pay detection and recovery processes at the end of the workflow. First, identity analytics, which includes verification and authentication of all provider identities and a commitment to ongoing background evaluations. This eliminates the recovery of mispayments and eliminates unqualified and risky providers from the payer's network proactively. The next layer is claims analytics. These are prepaid claims analytics that consist of rule-based screening and predictive modeling that identifies the potential for improper payments by scoring claims before the claim is paid. Finally, social network analytics. Much of the fraud that plagues healthcare payers is the result of organized, sophisticated, and collusive activities amongst providers and between providers and patients. Social network analysis can help identify relationships links, and hidden patterns of information sharing and interactions within potentially fraudulent clusters, including patient relationships with known perpetrators of healthcare fraud, links between recipients, businesses, assets, and relatives and associates, links between licensed and non-licensed, as well as sanctioned providers, and inappropriate relationships between patients, providers, employees, suppliers, partners, and otherwise. So what does this look like in terms of real fraud detection? Some examples of data analytics and use are the identification of providers who bill more over a specified period than other providers in the region, the detection of providers who authorize particularly expensive equipment, analysis of individual claims over time, which can reveal discrepancies and impossibilities which indicate possible identity threat or kickbacks, such as someone having multiple hysterectomies. Groups of individuals can also reveal kickbacks, like individuals in communities that suddenly switch to a less than convenient pharmacy. The ability to process data from healthcare data lakes is dependent on robust processing power. Using the foundation of Hadoop, systems can process pieces of information, workloads, in parallel rather than one system performing functions from start to finish. Similarly, data can be distributed and stored on various locations, which help balance workloads among available resources and eliminate single points of failure. Healthcare organizations must invest in a data processing system and use one data lake in order to generate actionable bits of information across various opportunities such as fraud detection, assisted diagnostics, and patient monitoring. This all helps reach their ROI much faster than ever before. Now that we have talked about the healthcare data, how the analytics are structured, and the technical architecture in which they are structured upon, let's discuss healthcare fraud detection in action. The fraud prevention system was created by the Centers for Medicare and Medicaid Services and was funded by the Small Businesses Jobs Act in 2010 and subsequently by the Affordable Care Act, with the express goal of identifying inappropriate healthcare payments. Like the systems used by credit card companies, this system uses predictive analytics to identify troublesome billing patterns and outlier claims. From 2012 to 2015, the fraud prevention system identified or prevented $820 million in inappropriate payments. In 2014 alone, the fraud prevention system identified $454 million in fraudulent payments, a 10-to-1 return on investment. While this is not a complete solution to the $60 billion of fraud that exists, the system only continues to improve and has made a huge improvement in the past several years. When discussing healthcare data and specifically fraud detection practices, it is important to keep in mind a few other considerations. The Fourth Amendment and HIPAA regulations provide privacy concerns in terms of the type of data that is being collected. These systems rely on stored long-term data as well as real-time data, so the security of these systems are paramount. Next, concerns have been raised about the accuracy of the data collected. The data often leads to expensive audits of healthcare providers and individuals, so the cleanliness and accuracy of the data is very important to fraud detection efforts. Also, the funding for the fraud prevention system has come into question, specifically because of the ties to the Affordable Care Act. Thus, research must continue to drive down the cost of these systems to continue for them to have a positive ROI. Finally, Fraud Prevention System 2.0 is on the horizon with more advanced modeling, which is necessary to keep with the changes that the fraudsters have every day. In summary, fraud detection is a critical component to data analytics in the healthcare space and represents a huge opportunity to drive efficiencies and provide much more affordable care for all. Thank you.